Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back to another episode of the Smile Sisters.
So today we want to talk about predictability.
Yes. So I want to talk about predictability when it comes to dental care.
Right.
As a general thing, and then also predictability when you're going in and deciding to do something like a smile makeover with, let's say, veneers or bonding.
Because dental care, just like any medical procedure, has no set outcome, really. Like, we can give you a range of possibilities, but we want to keep that range as narrow as possible, but there's always things that can happen because it's the human body and you're living your life doing stuff that it's out of our control. So
Yes.
How do we improve, or how do we narrow that range of outcomes, really, is what we're trying to do.
Totally. So I think a lot of people have fear as a general rule to go in, and often fear is more about the unknown or not understanding what's going to happen,
Right.
versus the actual real possibilities. So one of the things I try to do with our patients who come in for any kind of dentistry is really review, okay, I don't know what's going to happen, but there's maybe 3 possible outcomes here that could occur. Let's say we're talking about a tooth that's really broken down and we're trying to figure out, can we save it with a filling? Does it need a root canal or does it need to come out? Let's say those are your 3 options. And so talking about, okay, if we do this could be the outcome, or this, here are the possible costs to you for these outcomes. Here are the consequences to your general health and your dental health. Here are the options for you to restore that or fix that. So really making that clear and setting those standards, I think, is important.
Yes, and I also feel bad for our patients and for myself as a patient in other disciplines when you almost have to become super educated on something that, we studied this, we've been doing this for 20 years, but
Yes.
Someone who walks in, now they have to make the same decisions as if they have this high experience. So it's really hard, but that's what it's come down to, because there is so much fear and so much worry that, things can go wrong.
Right. So communication becomes super
Yes.
important.
Yes.
And of course, you have insurance, so your providers like your dentists and doctors are rushing just to try and see more patients because the system is set up in a way that we can't spend the proper amount of time with our patients reviewing this. And this is something that I fight every day.
Yes.
To try and have the time to sit one-on-one.
To sit and talk.
And to educate really about, what are we doing? What does this mean? What does this look like?
Right.
And so I feel like I'm always talking and giving the same sort of lecture. I feel like I'm lecturing, giving a lecture to my patients about, okay, here's what this is and this is what this means.
Yes.
But that's what's needed so they can make an informed decision rather than an emotionally charged decision, which is often fear-based.
It's a lot of fear and a lot of just take it out. I don't want to deal with it.
Yes.
But then taking it out has other consequences,
Yes.
and then we have to explain those. So I almost feel bad for our patients that they have to understand and make these decisions in a very highly stressful situation where maybe you're in pain or something's hurting and you have to understand all these different outcomes and try to make a decision. So
we can put this on from a cosmetic kind of makeover standpoint.
Yes.
It applies very much as well, because I have patients who come in and they've had, they want to fix their teeth, fix their smile. They don't like something about their smile. They want to correct it, but they're just afraid that it's going to fail, or what if it looks bad? And they usually will say to me, I have a friend who had such and such done and now it's awful. It looks terrible.
Right.
Or I have a friend who had some veneers done or bonding done and they're popping off all the time.
Right.
And she has to keep going in and getting it fixed. Things like that I hear. And that is a fear that patients bring in who want to do something positive for their smile and from a cosmetic standpoint, but are afraid because they've seen all these negative, outcomes in other people or negative outcomes in themselves. I have patients who come in who've had this kind of work done and it's
They're
failing.
redoing it over for the second and
Yes.
sometimes third times.
Exactly. And sometimes it's like, this is not at all what I wanted.
Right.
And so I wanted to talk a little bit about the process that we've developed here
Okay.
in order to mitigate that.
Yes.
You know? So we go through, when we do a smile makeover, we go through a series of about 7 appointments, you know? And really, to do, let's say, bonding, it really technically only takes 1 visit. You sit in the chair and we do it and you walk out.
Right.
But we go through so many checks and balances. And the main goal of this is, 1, to educate the patient on what we're going to do, what the outcome is, and to make sure that what we're delivering to our patient is what they were asking for and that it's predictable in that way.
Yes. And I've done some, bridges and anterior cases where we do the wax up and then when they go home, they come back and they still feel like, no, this is not exactly what I wanted. So there's even steps for that. Like maybe you don't even know exactly what you want. So that's the thing. Like sometimes with these cosmetic cases, you go home and you notice something. So we even try to mitigate that.
We do, yeah. So for example, our first step in this is to do a virtual consultation. And often that is such a good thing because it's cost-free to the patient.
Right.
They don't have to make the trip out here, because sometimes we'll get on a virtual call, I will, and the patient will say, I want veneers on my teeth to make them whatever. And then we really discover that, they have really severe gum disease, let's say, and their teeth are not good candidates for veneers. Maybe they actually need some extractions, like it's that severe.
Right.
Sometimes patients just have no idea about what's going on. So we can set them up at least to be like, well, actually, that's really not an option for you, but here are some other things. So even before you step into our practice, because one thing is, if you come in, there's a fee for us to see you and do an exam. And if you wanted veneers and you come in and I say to you, veneers are not an option, maybe you don't want to do any of the other treatment with us or be here for anything else. So the virtual appointment kind of takes that out of the equation. I can at least tell you
if you're a candidate.
Relatively, if you're a candidate. Of
I've
course,
had patients come on virtuals who have no teeth and they want veneers. And
yeah, so
it's just like about understanding what veneers are and what are the options.
Exactly. So that is like in those visits, I'm just talking about what is a veneer, what conditions can you do veneers for somebody, what other options are there, so I'm really just like, I feel like I'm giving a lecture every time on the virtual about what these things are. But it takes that out. And also we get to meet each other and kind of see if we connect. I can give you a price range. That's another thing.
Yes.
Veneers are not inexpensive. And sometimes people have no idea what the cost range really is. So I can at least give you some sort of range of what this is going to cost.
Exactly.
See if that's something that's even within your budget to consider.
Yes.
Then if all of that works out and we're good, then you get to come in and we sit down and face to face and we take some records like x-rays, photos, we do a digital scan, and we talk about, okay, what do we actually want to do? And sometimes it involves doing some orthodontics and then doing veneers. Sometimes it's just a whitening. We kind of talk about all the different options to get you to the result that you want.
Right. And this is where all those options come in.
Exactly.
And the education and understanding. Each option has its pros and cons. Each option has like a range of outcomes.
Yes.
And so you have to understand whatever you choose, it's not like set in stone that you're going to get like a perfect thing. Like there's a range. We want to minimize that range, but every option has its small range.
Exactly. So this, things that could occur if you do, for example, I have patients who, their teeth are slightly crooked, but they want veneers. I had a patient yesterday, she has some spacing. She has more spacing on one side than the other, doesn't want to do orthodontics first, just wants to do the veneers. So what are the consequences of doing veneers on someone like that and not doing orthodontics first? One side has a bigger space, so we have to kind of cut into the teeth a little more to accommodate for that.
Right.
The other side has less space. But if you do Invisalign, maybe we don't have to be as invasive. And also the result could be more ideal because the teeth can all be kind of the same width and the same shape and things like that. So we talk about the consequences of choosing different options and the cost price point of those different options.
Time. Each option also has different time commitments.
Totally.
And that's huge for some people, especially adults who are working, maybe they don't want to go through like 2 years of orthodontic treatment.
Exactly.
They just want to get to a result.
Right.
So all of these things.
So that's our second appointment, an in-person consultation. If we're ready to proceed and we want to do something that's going to change the shape of the smile with veneers or bonding, then we do a mock-up design. So we take the model of your teeth that we scanned, and I'll actually digitally design the shape of the veneers or bonding that we're going to do. So we talk about, do we want to lengthen the teeth? Do we want to bring them forward? Do we need to tuck them in? Or do we need to round the corners or make them more square or what?
Or make them bigger or smaller.
Right. And all of that has to do with having a really good conversation, interview with the patient to figure out what is it that you want.
Right.
I ask them to bring photos, show me what you like. Also talk about what is your face shape and what's going to look good.
Right.
Then I create that design and you get to come back.
And the color.
Well, the color we get to when we actually do the procedure.
Right.
But here we're designing the shape and make sure that it fits your bite. That's our third appointment. You come in for the fourth one and we do what's called a wax-up try-in or a mock-up try-in. We can actually take a mold of the design we made and with some temporary filling material, we just put it right over your teeth. And now you can see in your smile exactly what this is going to look like.
Right.
And this is all about predictability,
This is where you can really see it.
This is where you
without
can really see
actually doing anything.
And it's a really amazing moment to show that to patients.
That's a really fun moment.
This was, the result of what we discussed and the vision that I see for you. Do you agree? Do you love it? What is it? Usually it's like, oh my God, this is exactly what I wanted, because we've already gone through all of these things. But sometimes the patient will be like, oh, I wish this one was longer or whatever. And then we can actually sit there. I can add material to your tooth right there to get that shape. Sometimes people go home with that and they show their spouse or whatever, and you just peel it right off. It's totally reversible. You just flick it off of your teeth.
Yes,
okay?
with like a toothbrush, it'll come off.
So we've had the virtual, the in-person, the wax-up try-in. If we're happy with that, the price is right, everything works out, then you come in and we actually prep your teeth for the veneers, if we're doing porcelain veneers, and we make you temporaries to that shape that you originally
The one
liked.
that you approved in the mock-up.
Yeah.
Yes.
And then you go home. This is appointment 5. You go home and you get to kind of live with that, for a few weeks, usually a couple of weeks. And I see you for another follow-up visit, usually about 3 days after this preparation. And that's really to check in with you. Okay, you've had them in your mouth for 3 days. What do you think? Do you like how it looks?
Can you speak correctly? Are you like spitting or something weird?
Usually you're not making that much of a change for that to occur. But things like if you are, and we are checking the bite and adjusting it, but things like, are you chipping them off? Are you breaking them?
Right.
Maybe we need to do some adjustments to the way you're biting. And this mitigates any issues with your veneers breaking off down the line.
Later on, which is a common complaint.
But also you've had a chance to kind of go home and be with them for a few days. So you have a really much better idea of, does this fit your face? Do you love it? Or do you want to make any tweaks to it? And sometimes it's rounding a few corners and then it just kind of falls into place. It goes from kind of looking a little odd to just looking like your beautiful smile.
Right. Like looking like you.
Looking like you, exactly. And often it's already there in that visit. We're just like checking in and you're going home. But another important thing we do at that visit is choose color. So we look at colors of veneers, we look at photos, we shade match to your other teeth, to your lower teeth, and we make decisions on color, translucency, things like that.
Right.
Now you've been with these, you go home for another week and a half or so while the lab fabricates the veneers, and I send all this information to the lab, any changes that we made to them. So then you come back, 6th appointment, we're finally delivering or putting these things in your mouth.
Yes.
Again, we try them all in. Before we glue them in, you look, you get up, we go to the mirror, we go outside, look in the natural light, and we make sure, this is exactly what we wanted. And I'm making sure that the fit is right, that it's, they're done well and correctly.
The bite is right and all that stuff.
Then we glue these guys in, clean them up, and then check the bite, make sure everything's good. You come back for another appointment. This is appointment 7, I think now.
Yes, it is. Mm-hmm.
And at this appointment, this is usually about a week after. Again, we're following up. How does the bite feel? Are you comfortable? Any sensitivity? Any issues with your teeth? We make adjustments as needed, take final photos. Usually we're giving you retainers to wear over top.
Right.
It takes 7 appointments.
So how long is it from let's say if I decide to move forward from my virtual, like how long is the whole time span between my virtual to the time when I get my final veneers?
I mean, it can be as quickly as a month.
Right.
Now, this is barring any other issues that you might have. So if you have healthy gums, so if you come in and you have gum disease, gingivitis, we're not going to be doing veneers for you. We
Right.
need to take care of your gum issues first. So that can prolong treatment. But if you're somebody who's been going for general care, seeing your dentist, getting your checkups and cleanings, you have no like pending cavities, your bite is relatively good, like your teeth are not super crooked, then I also will refuse to do it. You need to do some orthodontics to align your bite first. Minor things we can adjust for, but if your
Right.
teeth are really not in
It's
the right
like
position,
really off. Yeah.
then you're not a good candidate. And these are the reasons why veneers fail, because people try to do them in situations where the base isn't right, where the gum disease is still happening, or where the bite is like really off.
Well, before orthodontics was more so commonplace and it was all about wires and brackets, there was a thing called like purposeful endo or something
Elective
where
endo?
elective endo,
Yes.
where to get your teeth straight by cutting into it a lot, you would actually have to get root canals. Like they would plan on it because they knew they had to cut it so much
Yes.
and that it would be in the nerve. So now we don't do that. Like we want to actually move the tooth itself.
Well, we don't do that, but some practitioners still do that
Right,
all the
right.
time. So that is the reason why these things fail, and it's a repercussion more so than just the cosmetic outcome. You're damaging your teeth in the long term,
Right.
and this is not reversible. So it's a huge problem.
Yes.
But anyways, we can be predictable. I know it seems like a lot of appointments and a lot of steps, but when we do these, we always get a result that the patient's happy with, that is successful, functional. It's going to last them for years as long as they take care of it,
Right.
which means frequent checkups and cleanings, make sure you're flossing and brushing, things like that.
Yeah.
Yeah.
Very cool. And if you want to get a virtual appointment with one of us, you can just go to our website, LA Dental Clinic, and just get online. We would love to chat with you.
Yep, it's easy to do it and it's free.
Yeah.
See you next time.
Okay, bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.